All right, so today we're going to do chapter 17, intracranial regulation. Okay, so this is seizure drugs. So we're going to be able to summarize the actions, uses, side effects, adverse reactions, nursing interventions of anticonvulsants, and recognize and plan the nursing care for patients taking anticonvulsants. Okay, so what is a seizure? A seizure is a disturbance of electrical activity in the brain. It can cause may affect a consciousness, motor activity, sensation. It usually has convulsions, which are like extreme spasms. It could be just of one facial little muscle. It could be of your eyes. It can be your whole body. But what we do is we treat you with anti-seizure meds. Epilepsy is when you have recurrent seizures, and usually, and there's something that's not on here. It might be later. Is status epilepticus, but we'll talk about it. So what can cause seizures? There's lots of stuff that can cause seizures. You may have one seizure and never have another seizure again in your life. Um, but common things are like strobe flickerings, especially with epilepsy. So like if you're going to a rave, it's not happening because the constant flashing light can induce seizures. Occurrence of small fluid and electrolyte imbalances. We've talked about that, about how hypernatremia and hyponatremia can cause seizures. It can be idiopathic, which is 50% of all seizures, which is a lot. When you don't know why they're happening, they just happen. It can be medications, it can be trauma, with drug withdrawal. There's lots of different reasons, okay? But a lot of times we don't know. We can have seizures in pregnancy with eclampsia and preeclampsia. Preeclampsia we know is the extreme hypertension, but the extreme hypertension can lead to seizures, which is full-blown eclampsia, which is what I just said. Okay, so you can have partial or focal seizures, so like that's like just the rolling of your eyes, just the one little muscle. Generalized is usually your whole body. And if I'm wrong on any of this, please go by your nursing class, okay? Um, so general concepts, we've still been talking about this. All right, so there's lots of different reasons why you would have a seizure. If it's a new drug, stop that drug. Okay, my grandmother had a seizure from meclizine, which is like Antivert or Dramamine adjacent. It's like it's for motion sickness. So and she never took it again. Never had another seizure. So if it's something easy, great. If we can't figure it out though, we may have to put you on medications. Okay. The biggest just go right into it. Barbiturates, which we've talked about before, but barbiturates are phenobarbital. We talked about how they can work on a specific synapse in the brain, but they have a very low margin of safety and a high potential for dependence because they are a controlled substance. Um, Here it is. I was going to talk about this earlier. So status epilepticus, which is when you're having a continuous seizure, so it's lasting more than 30 minutes, or two or more seizures without a full recovery of consciousness. So if you're having status epilepticus, which is when it's just a continuous seizure, and what they're talking about the recovery of consciousness, we call that the post-dictal phase. So when you're having a post-dictal phase, you'll have the seizures, you'll be kind of knocked out, but you won't be convulsing anymore for a little bit. And depending on the seizure, the type, how long it lasted, the post-dictal times can vary from a minute to an hour or longer. But if you don't fully recover and fully get back to whatever you were at baseline and you have another seizure, that's what they're talking about, okay? So, phenobarbital is a scheduled 4 drug. Like we said, there is dependence. With using this long term, you do have a vitamin D, a B9 or folate, and B12, which I believe is cycloblamin, cyanoblamin. Um, Deficiencies. Okay, so we have to make sure our patients know they may need supplements. Okay, they can have laryngospasms. You can have CNS depression, respiratory depression, coma, and death if you overdose. We always know you do not mix alcohol or CNS depressants with other CNS depressants, right? No cava, valerian, or chamomile either. Um, so the thing we talked about before is that it can cause tolerance, right? It is very, you can't have dependence, but you can also have tolerance. So taking this for a long time, you can need more and more and more to keep the seizures under control. So we do have to make sure our patients know they may need more over time. So the IM may have the local inflammatory reaction. IV is rarely used because it causes necrosis. Abrupt discontinuation can cause seizures. That goes for any of these drugs. Never ever stopped a seizure drug abruptly because you will have a lot of seizures. Don't do it. Okay. Also, with most of these drugs, do not get pregnant. Pregnancy is very stressful and can cause seizures, and these medications can usually hurt fetuses or feti. I don't know how to say that, whichever one it is. And even breastfeeding, bad. Okay. A friend of mine has really, really, really bad epilepsy, and she couldn't get off her meds if she wanted to have a child really, really bad. And so she started to wean herself off to get pregnant, and she started having seizures, and so she could never wean herself off. And so she adopted. So, she did what she had to do, but she could not have them naturally, and you shouldn't because it can hurt the fetus. The other thing, and the seizures also will hurt the fetus. The other thing is, we talked about pregnancy, we talked about breastfeeding, we talked about it'll come to me in a minute. All right, so when we give this medication, monitor airway and sedation. Avoid other CNS depressants, especially alcohol. Do not stop abruptly, okay? So since most of these seizure medications will cause you to be drowsy or some kind of lowering of your LOC, or normal expressions, we have to worry about falls, okay? There was an old instructor we used to have who had really, really bad seizures. And she was on a lot of seizure medications, and she just kind of spoke really slowly, and she was kind of monotone, and it never really got high because she had such bad seizures. If she That's what the medications did. It brought everything down, literally brought her personality down a couple notches. Because so she was very even kill. She didn't talk very loudly. She didn't have very much inflection in her voice. She talked kind of slow because that's what a lot of these drugs do. That's what I was going to say. So back to what we're talking about breastfeeding and pregnancy, all of these drugs, you don't cure seizures. You don't cure them. The medication is not going to cure them. You take it for a couple months and you're good for life. Nope, these are forever. And whatever works for you, works for you. Okay. Until they find what works for you, you may have seizures. Even when they find out what works for you, if you're not having a bunch of seizures, it might be the only thing that works for you. Okay. And you may be on multiple different types. So, with our CNS depressants, though, we know that we have to watch out for falls. Safety is a really big deal, making sure our side rails are up and all of those things, especially if our patient's new to seizures. We've talked about how we need to have our side rails up to avoid falls, seizing and falling off the bed and hurting our head. All right, so benzodiazepines, which we've talked about before, right? Our clonazepam, lorazepam, diazepam. These are what you do, okay? They use for absence seizures, myoclonic seizures. We also use diazepam for status epilepticus. So this is when tolerance can happen with these medications. We've talked about this before. Drowsiness, don't drink alcohol. You can have hypotension, respiratory depression. We have a antidote, which is flumazenil. Um, sure. If you're giving it IV, you need to make sure you have all vital signs been monitored: heart rate, blood pressure, respirations, oxygen saturation, not so much temperature, but all of the other ones, okay? Super, super important, especially with our IV, because they can happen, it works really, really fast, and you can have really, really bad side effects really, really fast, okay? It can cause fetal harm. We've talked about how most of these drugs can cause fetal harm. The PO forms can be taken 1 to 2 weeks to be there. Can take 1 to 2 weeks to become therapeutic. God, that was terrible. Tolerance can happen as soon as 4 weeks, so you may need a higher dose. So we monitor our blood, our LOC, our airway, our sedation levels, all of the vitals, right? Respirations, blood pressure, heart rate, oxygen saturation. Teach them not to take alcohol. They cannot drink alcohol with this or other CNS depressants. So besides our ABCs are always first for this one, right? And then we have our safety because this can cause that drowsiness as well. All right. But this is our go-to for status epilepticus as well. Okay. Okay. I'm gonna have to look up the qualifications for status epilepticus because I don't think it's 30 minutes. I think it's shorter than that. But hold on. Maybe it's on here. I'll get back to you. All right, so high Dantons and other high Dantons. Good things. The phenytoin is a high Danton. That's pretty much it. Okay, it is a very common drug. It is a very dangerous drug. Okay, it's got a lot of problems. So let's talk about it. They work on the sodium channels. So that's why when you work on sodium channels, you know, our sodium channels do so many things in our body. And so that's why you can have lots of side effects. Okay, so our side effects are dysrhythmias, bradycardia, VFib, which are all horrible, horrible. Um, VFib is really, really bad. Usually you have to do CPR when you're in VFib. It's a very, very bad heart rhythm. Okay. You can have severe hypotension. You can have hyperglycemia. You can have headache, nystagmus, which is when your eyes twitch, ataxia, which is abnormal, gait, trouble moving, confusion, slurred speech, paradoxical nervousness, twitching, insomnia, peripheral neuropathy, agranulocytosis, aplastic anemia. You can have skin reactions. You can have gingival hypertrophy, which is like gingivitis, so your gums swell. Um, if you give this IV, you have extreme warning. You should not exceed 50 milligrams per minute in adults. Okay, period. Don't go any faster. It is not IV push. It is pay attention to what you're doing. You can cause someone to have toxicity really fast. Okay, things that are not included on here is you have to have monthly blood draws for this medication because of the risk of toxicity. Some of the toxicity is the CNS reactions right here. So the right here. So the ataxia, the blurred vision, nystagmus, the clumsiness. We talked about the ataxia, slurred speech, blurred vision. Those are the symptoms of toxicity, and that's when we have a problem. Okay. So this is one of those medications you're going to have to monitor blood levels before you give the medication. We'll talk about that. So we talked about don't stop this abruptly. We talked about how bad that it can be. Always prime your lines with saline. If you use anything with dextrose, that means your piggyback has dextrose. The IV saline push you're giving has dextrose. If you put another drug on the same line that is getting phenytoin, you will cause precipitation, and precipitations can become emboli, and emboli kill people. Okay? So, saline only. If you're giving this IV, we need to be hooked up to a heart monitor because we need to watch out for these dysrhythmias and the VFib. We need to be watching our blood pressure. We need to be using a large bore IV. We do not use anything that has dextrose. Okay? All right. And we make sure that we push it appropriately and we're not pushing it too fast. Okay. These, like we've said before, seizure drugs are forever. If it works for you, it works for you. Do not get pregnant on this medication. If we do not give it IM because of the irritation, it is not recommended in pregnancy. If you become pregnant, you need to tell your doctor immediately. Okay. Monitor your heart rate, monitor your blood sugar, monitor your blood pressure. We talked about all that. Cardiac monitoring. Genetic testing might be needed for Asian descendants because of a possible interaction, and they could react poorly. Do not stop abruptly, which we talked about. Monitoring blood levels. Don't change brands or dosage once you are stabilized in therapy because you can have bad things. Good oral hygiene is important to prevent the gingival hypertrophy. That means going to the dentist. Okay. That's important. Yeah. Cool. Okay. So earlier we talked about related drugs. So the high Dantons, that's the dibenzazepine, so that's the carbamazepine. That is a medication that we use often, carbamazepine. It can cause hepatitis. It's not severe hepatitis, but it can still cause hepatitis. We need to monitor that one. I forgot to say that. Sorry. All right. So now we have another one, which is valproic acid. This is just an anti-epilepsy drug. It is not a high Danton. Valproic acid or you see these has like three different names: valproic acid, valproate sodium, divalexapro. These are interchangeable names. They all are by valproic acid once they have entered the stomach. They just start out as something different, if that makes sense. So like you have a medication, you have valproate sodium, but once you've ingested it and you start to metabolism, it turns into valproic acid. So though these three things have very different names, they are all still classified as valproic acid. However, you cannot just change your patients. Oh, they take valproic acid. Okay, they can take divalexapro. That's not how that works. Okay, whatever they're on, as we said with the high tannins, that's what they're on. Don't change it. Okay, they take that brand. That's the brand they take. Same thing happens here. But the reason we classify them like this is because they all are valproic acid, so they all have the same side effects. Okay? All right, so side effects are sedation and drowsiness, as we've said with most of these. Okay? You can also have GI upset, prolonged bleeding times. That's a pretty big one. So having abnormal bruising, abnormal bleeding, nosebleeds, checking your urine and your stool for blood, big problem. We got to watch out for all that, okay? Watch out for that bleeding. If they're taking aspirin, that is an interaction. They can't do that because of the warfarin, any other kinds of things that increase bleeding times, alcohol, it's a no-no, okay? Other things that we can have problems with is visual disturbances, muscle weaknesses, tremors, abnormal abdominal pain, pruritus, which we know is itching, photosensitivity, so wear your sunscreen, um, erythema multiforme, which is redness, right? Fatal hepatotoxicity, so monitoring our liver enzymes. We do not use this for children or hepatic patients, okay? We've talked about what you can need to avoid. Do not chew or break or half or crush the ER tablets. So the delayed release and the extended release, don't break them, don't crush them, don't half them up. Okay, don't do it. It is an acid. It will cause GI irritation and mouth sores. So don't crush them. Don't mix the syrup with carbonated beverages because it will cause throat irritation. Not recommended in pregnancy, once again. See some themes? All right, monitor for liver function, monitor for GI upset. Make sure you take it with food to prevent, the irritation. Do not stop it abruptly. Monitor therapeutic levels. Monitor for bleeding. And something that's not on here, wear sunscreen. All right. Succinimides. All right, these are some other ones. So we use these a lot. Lamotrigine, Lamictal, we use a lot. Okay, it's a very common drug. Okay, well, we're going to talk about ethosuximide. Okay, it's an anti-seizure medication. So we can have adverse effects are impaired mental and physical abilities, psychosis, extreme mood swings, suicidal behavior, headache, lethargy, fatigue, ataxia. You see how most of them cause drowsiness and ataxia. Attention difficulty, bone marrow suppression, gingival hypertrophy again, so make sure you go to the dentist and brush your teeth. Weight loss. All right. Things that we want to avoid is ginkgo, which I'm pretty sure is on, yeah, phenytoin as well. Ginkgo and most of these seizure drugs are a no-no. Okay, we know ginkgo is one of those bad ones. Okay. And we talked about valproic acid having increased bleeding times, but it doesn't say the food on there. The three G's in feverfew, yeah, definitely a no-no. So, okay, do not stop abruptly. Once again, okay. Monitor for behavioral changes. Make sure you tell them about good oral hygiene. Go to the dentist regularly. Do not stop abruptly. Monitor their drug levels. This is one that you have to monitor your drug levels. Monitor your CBC for all those bone marrow suppressions. Monitor your liver and kidney function, okay? Because we do not want to have toxicity. All right, that concludes all of the lovely seizure meds, okay? If you have any questions, please put them in the discussion board, and I will let you know about the status epilepticus. It should be on your drug cabinet. Okay, thank you. Bye.